So alright guys, so here we're going to talk about the types of neoplasm and also the nomenclatures. That's what we're going to discuss about it. So, when we talk about the neoplasm, like neoplasia, right? Usually we divide neoplasia in two types, okay? One is benign. Let's just write it down here, all right? One is basically, we can say this is a benign, and other one is malignant, all right? Now remember, malignant. So basically it's benign. We're talking about the benign tumors or malignant tumors, right? Remember, this benign is also called, remember, this neoplasia, or let's say we can simply say slash, let's say tumor, or we can even simply say tumor right here. And then also because this basically means tumor with, this tumor is actually the cardinal signs of inflammations. Originally, that was actually described as swelling of the, anything that is swollen, we used to call that tumor. But now, in modern era, whenever we say tumor, we're actually referring that as a neoplastic, okay? And tumor also, there's another thing we can say, we can also call them a cancer, right? Remember, this cancer can be benign and can be malignant, right? So the benign versions of cancer, we can simply call them let's just say non-cancerous, right? Non-cancerous. And then if you're talking with the malignant, we can call them cancerous, all right? So this is also, we can simply say this, right? Now we have to see what is the difference between the benign tumors and malignant tumors. That's something that we have to remember, right? We have to describe, and we have to know this. So remember, one of the concepts, whenever we're talking with the benign, you have to remember this. The benigns are, let's just say these are the tumor, these are neoplastic tumor, but these are basically these are localized. Let's just say these are localized tumors. So we can say that this is a tumor of, let's just say this is a liver right here, right? And this liver, but this is a localized tumor of this, right? So this is an abnormal but localized mass of the tumor, all right? And it is not. So it's, let's just say one of the characteristics is it's a localized, right? Let's just say it's a localized. Second, all right? Okay, let's just say this is localized. Second point you should remember is it is not invasive. So it's not non-invasive. It does not spread. That's something you have to remember. Or it doesn't have a characteristic of metastatic. So it is a non-metastatic, okay? Not only this, it is localized, it is non-invasive, non-metastatic, but this tumor, this mass, this abnormal mass is well differentiated, all right? The well differentiated, this is also something that you have to remember, right? The well differentiated. On top of this, remember, if you look at this, it's a localized, it's non-invasive, and it is a well differentiated mass. And if you look at the mitotic activity or the cellular divisions of the cells, you'd find relatively less, right? So we can simply say that, there is a low activity, let's just say low activity or lower cellular divisions, or simply low mitotic activity, all right? Remember, and so it is a localized match, which is non-invasive, it is non-metastatic, it is a well-differentiated, low mitotic activity, and usually benign tumors are amenable. Let's just say this is you're amenable for surgery, all right? Amenable for, so you can actually surgically remove this benign tumor, all right? Remember, this is very, very important that, and these are usually non-cancerous tumor. But whenever we talk about, let's just say, the malignant tumor, right? So when we discuss about the malignant tumors, you have to remember this, right? Malignant tumors are what? They are invasive, right? They're invasive. They are basically invasive, or let's just say penetrating, all right? And they're also metastatic. This is something you remember, all right? This malignant tumor, because they have a malignant behaviors, okay? The biological behaviors of the tumor is aggressive, right? So it is invasive. It can invade to the nearby the tissue, and they can destroy, all right? They can do that. And they can also detach from the original mass, and then they can actually, through the, maybe, they can spray through the, let's just say, either lymphatics or the hematogenous through the bloodstream, and they go to the foreign areas, different locations, and they can actually go and make another secondary mass that is called metastatic, okay? So the malignant tumors have that. On top of that, you also have to remember, these are basically, usually look, these guys have, whenever you look at it, right? Whenever you look at the nucleus of the cells, if you look at this, like for example, let's just say, if this is a 2 cells right here, right? And then if you look at this, let's just say 1 here, the nucleus, right? And if you look at the nucleus inside there, I'll make it, okay, I'll just make it a blue again. If you look at this, this is what you see. You see basically, this is normal. But if you look at this, the nucleus of the, let's say this is normal. If you look at the malignant, you look very, very dark. Dark appearance nucleus you see, right? Which means that malignant tumors, basically, one of the characteristics of malignant tumors is that, that they have nucleus which appear much more darker, okay? So because of this, right? So this is normal. You can simply say, okay, this is normal. But if you say, look at this one, it is much more darker in appearance, right? And this darker appearance of nucleus, we call them a hyperchromosia, or we can also call them a hyperchromatic, okay? The color, we're talking the chromatic, we're talking the color of the nucleus becomes very dark, right? So hyperchromatic, that's what you get to see. So this is number 3 here. And not only this, whenever you look at this one right here, look, you have a high mitotic activity, right? This is what you see in basically in this aggressive malignant or cancerous tumor, high mitotic activity. This is what you see. And not only this, in the malignant tumor, it's aggressive. It is a rapidly growing tumor, right? So if you look at the ratio of the nucleus and the cytoplasm, you also see difference in there, right? So because of the more abundance amount of the nucleus, so you basically see increase what the ratio of, let's just say, nucleus and cytoplasm ratio is increased there. And not only this, there's also, look, what else is there? What else you can find? There's also going to be pleomorphisms, right? What is pleomorphism means? Meaning that the size and shape, colors are also different, the different morphological changes that you see in the malignant or cancerous tumor. One of the additional findings, some of the additional findings that you can see on basically malignant tumor is that, sometimes really what happens is this, let's just say that because malignant tumors are supported by, let's just say, the stroma or the supporting connective tissue. Let's for example, if this is a malignant tumor right here, this abnormal mass, right? And there is basically, look, the blood vessels that is actually supplying down here, right? And if the blood vessels are supplying, what happens is that, usually the blood vessels is supplying the side of this mass, right? And because what happens is that because these are rapidly growing, the blood vessels that are actually bringing blood and oxygen, nutrients, right? That is basically scanty, okay? Blood vessels are relatively less comparing to the cells that are actually proliferating. So what happens is sometimes what happens is that the central piece go necrosis, right? So there is a central necrosis that you see, right? You see central, let's just say, necrosis. Also you see in malignant, or let's just say in cancer, all right? Remember, so these are like, look, some of the difference between benign versus malignant tumor, right? Benign is or relatively localized. It has an innocent behavior. Sometimes we also, some of the books even describe this as let's just say, innocent behavior, meaning that they do not invade or they do not penetrate, right? And they do not destroy nearby tissue. But when it comes to malignant, it is invasive, it's penetrating, it destroys nearby tissue. It can also metastasize. It can go different. It can actually infiltrate and go to different locations and make a secondary mass there, right? And remember, when you look histologically, these are some of the morphological or histological you see in malignant tumor, okay? And these are basically what? Some of them are, as I said, high mitotic activity, increase in nucleus and cytoplasm ratio. There is a pleomorphism, different size and shape of the cells. They lost the uniformity or they lost the architectures of the cell or orientations of the cells, right? And also sometimes you also get to see like a central necrosis, right? This is something that you should remember. Now, but one thing that I do have to tell you guys is that just because it is benign, okay, and it is localized and is not metastatic, does not mean that this does not cause, clinical manifestations. There are benign tumors. They can give you clinical manifestations also, right? Like for example, benign tumors can do something called, look, if I have to make this, like some of the benign tumors, they can actually, look, even though they're benign and localized, but they can actually cause compressions. Like for example, if there's a tumor happening on your neck, sometimes that tumor can actually compress the trachea, and that can give you more clinical findings, okay? On top of that, let's just say if I make a, let's just say one here, and if I make, let's just say, the brain, and there is, let's just say, one tumor that happens in the arachnoid matter, right? And this is basically called meningioma, right? If there is a meningioma, sometimes the meningioma, which is a relatively benign tumor, but this can actually cause, that can compress this meningeal layer, and that basically can increase intracranial pressures, and that can give you a lot of clinical manifestations, clinical conditions, right? Not only, this is like one of the examples of that, right? So basically, you should remember that there are benign tumors which are localized and relatively stable, and they can be amenable for surgery, and sometimes there is a 100% cure for the benign tumor, right? But still, there are benign tumors which can actually cause the clinical symptoms also, okay? This is something that you have to remember. These are exceptions, right? Now, guys, so here, what I'm trying to do is that I'm trying to make your concept even more clear by putting this image here. And I got this image from the Robbins, and you can see that how you can actually differentiate between the benign versus the malignant. It is very important that you do, as you discussed, like, when you talk about the benign, it's a well differentiated, right? And when it comes to malignant, it's some lack of differentiation, like anaplasia sort of structures, right? The rate of growth is very important. When it comes to benign, it's relatively slower. When it comes to the malignant, it's erratic, right? It basically may be slow to rapid, but the mitotic figures are numerous, as we talked about that too. And this is also important. The local invasions is very important, that these are usually cohesive, they're well demarcated masses when it comes to benign, and then when it comes to malignant, these are infiltrative and penetrating, and basically that can actually destroy the nearby tissue as well, right? So you can read this really well, and make sure you know how to actually distinguish between the malignant versus the benign. I have to talk about, there are two conditions that I have to discuss about, and those ones are basically, they are not neoplastic, but they are non-neoplastic tumor. That's how something I have to discuss about. And those non-neoplastic, let's write down here. Those are non-neoplastic, okay? Non-neoplastic, all right? And this is very important, and I have to make sure that this is, you guys understand this really well. One is called, okay, these are non-neoplastic. One is called, let's just say, choristoma, okay? And the other one is called, let's just say, hamartoma. Okay, this is something that these two, the non-neoplastic, okay, tumor, or let's just say, there's conditions you have to remember. What are these choristomas and hamartoma means? And remember, this choristoma, these are also, look, they both are, look, what is the difference between choristoma? This choristoma basically means that, you have a, let's just say, for example, we'll just make this as a, let's just say that, you make a example. Let's just, this is a liver, right? And you basically see there is a, the liver cells are there. Like, let's say these are liver cells one. This liver cells you found in maybe different locations. Like, for example, these liver cells are maybe found in, maybe like here, in your GI mucosa right here. Like in GI mucosa, let's just make it in blue here. And this, if you found liver cells on your GI mucosa, right? Now what happens? This is a foreign location. This is a different, this is an ectopic locations. These cells, which are actually found in they are the cells that do not belong to the gastric mucosa. They actually belong to the liver cells, all right? Let me give you another example. For example, let's talk about this, let's just say this is ovary, right? Let's just say this is ovary. Sometimes you can find these ovarian cells, right? In where? In basically, in this called pancreas, right? In basically, let's just say these ovarian cells you find in this pancreas, right? These ovarian cells, which are this normally arranged ovarian cells, which are found in a different locations or ectopic or foreign locations, then we call them a choristoma. All right, so that is choristoma. So again, one more time, I'm going to repeat this. The normal cells, all right, normally arranged, but they are just in a different location. That is choriostoma. But if you're talking about the hamartoma, okay, these cells are, look, what happens is that, okay, let's just say, again, use the same examples, use this. Let's just say that, okay, let's use different, let's use the examples of colon actually. And then maybe make this. You basically see this. And here what happens is that these cells, like right here, these are, the location is what happens. This one is this ovarian cells are found in pancreas. Ovarian cells are found in the pancreas. Right? Pancreas are different locations, right? So that is choriostoma. But let's just say, if this is a cell that belongs to this, let's just say in the colon, right? This colon epithelium, right? And what happens is that, but this mucosa cells, which belongs to the colon, but they are arranged in a disorganized fashion, right? So the location is the same, but it's just that the architectures of the cells, or the cells are organized in basically a disorganized form, right? Then we call them a hamartoma, okay? So this hamartoma, and one of the classical examples of a hamartoma is basically, there's something called like Peutz Hager polyp, okay? The Peutz Hager polyp was basically, there is the mucosa that originate from the colon, but this epithelium are basically arranging themselves in a disorganized fashion. Then we call them a hamartoma. Please guys, do not get confused with hamartoma with hematoma. There's a hematoma. Remember there's no R there, right? So hematoma basically means the collections of the blood, right? When there is a collections of the blood, right? A clot is formed. Now then we call them a hematoma. Hematoma is different than hamartoma. But all three are non-neoplastic. And this is something that you have to remember. And I'm going to show you the pictures of this as well. Okay, so here I'm showing an image of the hamartoma. This is a pulmonary nodules right here, and I got this from this source right here. And basically, again, the hamartoma basically means it's abnormally arranged tissue which is present at the what? Normal location. That's what basically hamartoma means. These cells, they belong to lungs, but the cells are sort of arranged or in disorganizedly, all right? That's what hamartoma means. And remember, this is still non-neoplastic. The other non-neoplastic is your choriostoma. And the choristomas are what? They are normally arranged tissues, but just at a different locations. That is called choriostoma. And remember, choristomas are congenital anomaly, all right? After this, let's go and discuss about the nomenclatures of the benign tumor versus the, let's say, malignant tumor. How the tumors are named, we're going to discuss about this. So usually in generally, the tumors are named generally based on the origins of their cells, right? So basically, if the tumors are there, let me just erase this, right? Based on this, you can have a tumors that can be basically from, let's just say let's just say if it's a tumor, benign tumor, let's just say we're going to talk about benign tumor first, right? So benign tumor can be from two places, okay? But what are these two places? It could be from, let's just say, mesenchymal in origin, okay? Or it could be from the epithelial, okay? So basically, the tumors, the benign tumors can come from the mesenchymal cells or epithelial cells. But one of the things you have to remember here is that in generally, all right, the benign tumors, does not matter where they come from, mesenchymals or let's just say epithelial, they usually have this suffix added to it, okay? But the suffix that you have to remember, that suffix is oma, all right? This suffix is oma, all right? So usually in the benign tumors, there's an oma word added, the suffix is added, all right? And basically that tells you the tumor is whether benign or it is cancerous, all right? Whether the tumor is non-cancerous or cancerous, usually there's this oma added. But remember one more thing. There is an exception, sorry. Not every tumor that has a word oma into it, it is a what? It is benign. There are some tumors that has the suffix oma added to it, but they are not benign, they're malignant, okay? Like for example, I'll give you one example, like melanoma. melanoma is a malignant tumor, all right? But there are some tumors which also has, let's say, oma, but they are not benign or they are malignant. They are non-neoplastic. Like for example, choriostoma, hematoma, even some of them are like granuloma. Okay, so you have to know some of this. All right, they're non-neoplastic, but they have at the end they have a suffix oma added to it. But still, they do not classify it into any of this. Classified into benign tumor. So there are exceptions, and you need to remember the exceptions. All right. Now, let's go and talk about the mesenchymal one, right? So how do we name? If let's just say, if they are coming from if the mesenchymal, the derivatives of mesenchymal cells are what? These are basically, look, if you look at this structure right here, right? All of this structure I drew here, these are mesenchymals, all right? So, and we're talking the benign tumor. All right, here. So the benign one, and if you look at this one here, and this one you can think about this is what? This is a bones, right? And here you can think of this green is basically a cartilage, all right? This is, you can simply a cartilage, all right? Or basically it's a chondrocytes. We can simply say it's a chondrocytes, right? So if there's a tumor that happens, arises from the chondrocytes, then basically we call them up, it is chondro, right? It is chondro, but it is, at the end, it has oma added into it, right? So that is called chondroma, right? But now if you look at this one, what is it? These are called adipocytes, right? So these adipocytes, let's just write down here. These are adipocytes, right? If the tumors are originating from the adipocytes, and if it's a benign tumor, okay, it's mesenchymal in nature, then we call them up. Let's just say it is a lipoma, okay? See, there's oma added there. Now, if it's coming from, let's say, striated muscles, right, skeletal muscle, then we call them, what do we call them? We call them up rhabdo. This is called rhabdomyoma. Okay, it's a rhabdomyoma. Look at this oma is there. And what about this? And this is striated muscle. So right down, you have a striated muscles. All right. What about this one? This is a fibrocytes. All right. So this is fibrocytes. So if it's coming from fibrocytes, what do we call them? What do we call them? This is a benign tumor and mesenchymal in nature. And this is basically called, right here, fibrocytes. We call them a fibroma. All right, this is fibroma. See, there's oma is there. And what about this? This is smooth muscle cells, right? And if the smooth muscle cells, if it's coming from smooth muscle cells, then we call them up. Remember, this is input. It's called leomyoma. All right, so it's a leomyoma is there, right? And these are lymph vessels. Let's just say if this is a lymph vessels, what do we call them? Lymph. Look, if it's a lymph vessel, it is not a lymphoma though, okay? It is not a lymphoma. If it's coming from lymph vessel, what is it called? Lymph angioma, right? Lymph angioma. That's what we call them. If it's coming from, let's just say this blood vessels right here, right? What do you call them? If it's a blood, we call them hemiangioma.